giving us 5 minutes, and we get so excited about talking about their thing, so it's good that there's a timer right here behind me. I am delighted to be here this evening. This is an opportunity that doesn't come our way every day, and so the chance to speak to a number of people in our community who might not know anything about us is a great chance. I've been with Regional Residential Services for 30 years. And have loved every minute of it, so I want to be able to share with you sort of the evolution of the organization in that period of time. We actually began in 1979 out of the deinstitutionalization movement in our province, closure of large congregate settings where adults with developmental disabilities have been housed for decades in our province. And so in the very early days, our RSS was formed out of families who had a sincere and deep interest in having better lives for their family members in community. So that was the foundation, the root of our organization. And we began with what we call our group homes, and many of you would know a group home, you know what that means. And most of those homes ranged in number from 7 to 12, housing 7 to 12 individuals. And while it didn't take us too long to figure out that that wasn't a whole lot better than the large congregate care facilities that people had lived in, and while we still have some of these big group homes, they are smaller than they used to be. The largest now would be 8. Most of them are around 6. And in 1982, which was 3 years after, we began to realize that smaller was better. And the more we could actually develop homes around individuals who actually had something in common, compatibility, common interests and passions, the likelihood of them being successful as housemates long-term was far greater. So in 1984, we started what we called our small option program. So there are, at this time, 33 small option programs that our RSS operates around Metro. We still have 8 of our larger homes, although they're smaller than they used to be. We've had an alternate family program and an individual supported apartment program where people have visiting support, and they may live alone by and large, but do require some supports. It could be around planning meals, could be around banking, could be around just caring for their apartment. So most of the folks we support actually have a 24-hour, 7-day-a-week support program, but there are many who also are supported just through visitation by staff. The thing that has changed the most in my time with our RSS is our connection to community. And that's the biggest reason I was delighted to come talk to you this evening, is that although people are living in community, we're not always great at being able to get them what they need to access community and be meaningful participants. So we're supported financially through the Department of Community Services, the Supports for Persons with Disabilities program. And that pays for staff support, it pays for housing costs, it pays for food, but there are some real limitations around access to funds to be able to live in our community in meaningful ways, to explore our interests, enjoy what we're passionate about. We just had a conversation earlier around art and being able to explore those interests, having money to take a vacation and see something that you might not have seen before. And so while basic needs are met through the current funding, the piece that we struggle with is being able to be sure people have money to access to do what they love. And to, through common interests and shared passions, be able to make meaningful connections with other people who are not paid staff. People who will call you up and ask you to go for a drink on Thursday evening, who will visit you if you're in the hospital, who will invite you over for coffee, who will call you when they're going for a walk in the neighborhood and invite you to join them. And often it's how do we make those meaningful connections. And there's lots of incredible things happening. The adults, the men and women we support, range in age from 20 to 80. And getting connections for people and affording opportunity for them to contribute back to their community in meaningful ways is also important and has grown to a large extent. People are working, they're involved, they're contributing citizens, they're volunteering from Feed Nova Scotia to Cancer Society to their local church communities and neighborhoods, providing assistance to an elderly neighbor by helping to shovel or baking cookies and dropping them off. But we have people we support have contributions to make back to community too, and it's just getting the doors open for them to have a chance to be involved in a meaningful way. So funds received by our organization, which is a private nonprofit. We have a 12 board of directors of 12 members who oversee the organization. organization, but we have 175 adults participators at this point that we serve in 61 locations and about 450 employees providing that support. So it's a big organization, and because it's a 24-hour, 7-day-a-week operation, it takes a lot of people to keep it going. So I just wanted to make sure you understand that any funds that are coming to the organization will go toward directly to the lives of the residents and their choices and passions and interests, and get them connected to community in meaningful ways. So thank you.